The infection control exam trips people up more than any other DANB component. And again, it's not because they're not prepared or ready for the test. It's just that the DANB purposely makes these questions tricky, so you're having to think like a dental assistant. Hi, this your girl Leela. Who else? And welcome back to
The DAStudySpot, yeah.
Today, I'm giving you 10 must-know infection control questions, plus the answer, plus an exam tip so you understand why the answer is the way it is. Let's get started, but before we do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it!
Question 1. What is the difference between sterilization and disinfection? The answer, sterilization destroys all microorganisms, including bacterial spores. Disinfection eliminates many or all pathogenic microorganisms, but does not reliably kill bacterial spores. Exam tip: if a question mentions spores, the correct answer is always sterilization, not disinfection. Question 2. What are the 3 levels of disinfection? The answer, high-level disinfection, which kills all microorganisms except large numbers of bacterial spores. Intermediate level disinfection, which kills microbacteria, including TB, most viruses, and bacteria. Low-level disinfection, which kills some bacteria and viruses, but not microbacteria or spores. Exam tip: semi-critical instruments are instruments that contact mucous membranes. They should be heat sterilized whenever possible. High-level disinfection is used only if the item is heat sensitive, and environmental surfaces typically require low to intermediate level disinfection. Question 3. What is the Spore test and why is it used? The answer, a Spore test or biological monitoring is the gold standard for verifying that a sterilizer is functioning properly. It uses high resistant bacterial spores to confirm that sterilization conditions were achieved. Exam tip: Spore tests should be performed at least weekly, and every load containing implantable devices must be tested. If asked for the best method to verify sterilization, choose biological monitoring over chemical or mechanical indicators. Question 4. What PPE is required during instrument processing? The answer, utility gloves, masks, protective eyewear or face shield, and a gown or a lab coat. Regular exam gloves are not appropriate for instrument processing. Exam tip: utility gloves are puncture resistant and thicker, making them safe for handling contaminated instruments and sharps. Question 5. What is the correct order of instrument processing? The answer, transport, clean, inspect, package, sterilize, store. Exam tip: packaging must occur before sterilization, never after. Watch for answer choices that mix up the order. Question 6. What is the difference between a single-use and a reusable item in dental infection control? The answer, single-use items, also called disposable items, are intended for one patient only and must be discarded after use. Examples include saliva injectors, plastic barriers, and needles. Reusable items must go through the full instrument processing cycle before being used on another patient. Exam tip: the ICE exam will give you a list of items and ask you to identify which are single-use versus reusable. Needles, saliva injectors, and prophy cups are always single-use. Mirrors, forceps, and condensers are reusable. When in doubt, if it can be sterilized without damage, it's reusable. Question 7. What is hand hygiene and when is it required in the dental setting? Hand hygiene means washing hands with soap and water or using an alcohol-based hand rub to remove or kill microorganisms. It is required before gloving, immediately after removing gloves, before and after treating each patient, and after contact with any potentially contaminated surfaces. Exam tip: the ICE exam will ask about hand hygiene timing, not just technique. The key detail students miss is that you must wash hands after removing gloves, not just before putting them on. Gloves are not a substitute for hand hygiene. Question 8. What is the purpose of surface barriers? The answer, surface barriers protect clinical contact surfaces that are difficult to disinfect from cross-contamination. Common examples include light handles, chair controls, and x-ray equipment. Exam tip: barriers must be changed between every patient. If a surface is visibly contaminated, it must be cleaned before placing a new barrier. Question 9. What should a dental assistant do immediately after a needle stick injury? The answer, remove gloves, wash the area thoroughly with soap and water, report the incident, document it, and follow the office's exposure control plan for evaluation and possible post-exposure prophylaxis. Exam tip: Do not squeeze the wound. Washing the area is always the first step, followed by reporting according to Occupational Safety and Health Administration guidelines. Last question, number 10. What is the chain of infection and how does dentistry break it? The answer: the chain of infection is a six-link sequence that must be complete for disease to spread, starting with infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Dentistry breaks the chain through sterilization, PPE, hand hygiene, and surface barriers, interrupting transmission before it reaches the patient or provider. Exam tip: the ICE exam will ask you to identify which infection control practice breaks which link in the chain. For example, PPE breaks the portal of entry link, sterilization breaks the infectious agent link. Know your links and match them to the practice.
All right, y'all, those are your 10 must-know DANB infection control questions. Don't say I never gave you anything. Screenshot the ones that surprise you and add them to your study rotation. And if you want 375 plus more practice questions like these with answers and rationale, exam overviews for all 3 exams, what to expect on test day, and 6 modules with everything you need to know to get certified on the first try. Go ahead and click that link in my bio and get your copy. And if you haven't done so already, go ahead and download the free CDA cheat sheet that has the 10 must-know questions that you need to know for the CDA exam. Click that link in my bio so you can get started right now. Also, shout out to the pre-sale purchasers and good luck on your exam. Be sure to come back and tell me how you did. If you found this video helpful, subscribe, but don't forget to like, save, and share with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.